Hi, my name is Pham and my presentation today is the undiagnosed burden of type 2 diabetes in Asian Americans. Type 2 diabetes is a condition in which the body cannot respond or use insulin properly to regulate blood sugar levels. It is preventable with early diagnosis and healthy lifestyle change. However, approximately 8.7 million cases remain undiagnosed in the United States. The purpose of this epidemiological review is to raise awareness of type 2 diabetes among Asian Americans and to highlight the need for early intervention in this underserved group. Diabetes affects 38.4 million Americans, with 90 to 95% have type 2 diabetes. The economic impact is high, with $413 billion in annual healthcare costs, a 35% rise over the past decade. Type 2 diabetes is the fifth leading cause of death among Asian Americans. However, nearly 50% of the cases go undetected. Standard diagnosis tests for type 2 diabetes including fasting glucose, oral glucose tolerance, random glucose, and hemoglobin A1C. Body mass index (BMI) commonly used to measure body fat and type 2 diabetes risk. These tests are widely used but might not identify risk in this population. Asian Americans have 34% lower odds of receiving diabetes screening. According to a Renata, hemoglobin A1C has low sensitivity compared to oral glucose tolerance test and fails to diagnose 60% of Asian adults with newly cases. BMI greater than 25 cutoff might overlook at-risk individuals, and there are some other issues related to screening, such as limited access to screening, low health literacy and public awareness, cultural stigma, and provider bias. The current guideline recommendation for screening among this population is a BMI greater than 23. Asian Americans represent approximately 7% of the U.S. population. By 2060, their population is projected to reach 35.8 million. They are 40% more likely to be diagnosed with type 2 diabetes compared to other ethnic groups, despite having lower body mass index. Higher visceral fat is linked to insulin resistance. Surprisingly, 50% of the cases are estimated to be undiagnosed. 9.1% of Asian Americans have type 2 diabetes. This is lower than non-Hispanic Black and Hispanic adults, however, is higher than non-Hispanic white. But when we break down the Asian American group, we can see the race vary in this subgroup, with Filipino American 12.2% and Asian Indian Americans 10.8% exhibit the highest risk. This rate is comparable or even exceeds those in higher risk. Risk factors for type 2 diabetes include age 45 and older, family history of diabetes, ethnic minorities at higher risk, and history of gestational diabetes. Some other contributing factors include increased visceral fat, lifestyle changes, socioeconomic factors, and cultural background. Asian Americans were 60% more likely to be diagnosed with end-stage renal disease and higher rates of diabetes-related death compared to non-Hispanic white. Type 2 diabetes in Asian Americans can be prevented by promoting screening at 23 campaigns, education on risk factors, and improved access to diabetes-related resources. Lifestyle modifications such as a balanced diet, regular physical activity, avoiding smoking and excessive alcohol consumption. Engage and motivate upstream stakeholders to develop and implement effective strategy and solutions that target the rise in type 2 diabetes within this population. Early education and targeted screening are key to identifying type 2 diabetes risk in Asian Americans, reducing undiagnosed cases, lowering healthcare costs, and improving population health outcomes. Healthcare providers should promote healthy lifestyle behaviors during routine care to educate patients about type 2 diabetes, risk factors, and complications. Addressing barriers, increasing research and funding are essential to reduce the growing burden of type 2 diabetes within this population and advancing health equity. Collaboration with communities and organizations is crucial to meet the special needs of diverse Asian Americans and improve type 2 diabetes outcomes in this population. For the reference list, please scan the barcode to access it. Thank you so much for listening.